So one of those triggers is nitric oxide. So not the same as nitrous oxide. So nitrous oxide, you might have heard, I don't think they use it in dentistry anymore, but you might have heard of like nitrous oxide as laughing gas. It's not the same. It has the same elements, but not the same ratio and configuration. So nitric oxide is actually a very important molecule in cell signaling. And the thing is that it triggers the production of a substance we call cyclic GMP. And do I want you to know exactly what cyclic GMP is? I mean, most of you haven't had chemistry or biochemistry, so not at this point. But what I want you to know is that this is how nitric oxide leads to vasodilation. It triggers the production of another chemical that causes vessels to open up. So nitric oxide means your vessels will relax. Now, nitroglycerin. If you watch things like cartoons, you might have seen like nitroglycerin is something used in explosives and dynamite. So, interesting thing, same chemical formula, but it's not in the same form as or concentration as an explosive. So the interesting thing about nitroglycerin is it's given as a vasodilator to cardiac patients. So the interesting thing is that when you give someone nitroglycerin, your body metabolizes it to form nitric oxide. And this is the chemical formula. And if you look at here, so these little blue balls, these are nitrogen atoms. And what can happen, the whole thing is nitroglycerin. So your body can metabolize it and pinch off these little nitric oxides to pinch off these nitrogen atoms and their oxygen molecules, oxygen atoms to form nitric oxide. Okay, so that was interesting. Dr. Keanu Reeves, before he was John Wick. And what did he say? Like, oh, one of your arteries that supply your heart are blocked. And he's saying, was he having a heart attack, right? We covered what that was. And nitroglycerin, so remember that is a vasodilator. And he asked him, and actually that young woman, that was I forgot what Jack Nicholson's character was called, what his name was. But in that movie, that's who he was dating, and that's why he denied taking Viagra. Now, the interesting thing about Viagra, and this is what Pfizer was famous for before this vaccine, is that, I mean, they did many different drugs, but this was probably their most popular one. Like, there were so many jokes about this in the 2000s. But this is sildenafil, and I think it's now generic because it's been enough time since its invention and trademarking that they can offer generic versions. So it involves this one enzyme they're targeting. So this enzyme we call PDE5. This breaks down that cyclic GMP. And remember that cyclic GMP causes vasodilation. So this PDE5 actually turns off cyclic GMP, thereby preventing vasodilation. So the interesting thing is that this Viagra or sildenafil for generic inhibits PDE5 activity. So basically it turns off the mechanism that turns off vasodilation. So two negatives equals a positive. So what happens is that by PDE5, again, PDE5 breaks down cyclic GMP, but sildenafil actually inhibits this enzyme. So now cyclic GMP can stay longer in the circulation. Therefore, it maintains vasodilation. And as someone pointed out in chat, when you have vasodilation, it's like going from tight-fitting clothes to looser-fitting clothes. What happens to the pressure? By going from tight to loose, you loosen up the pressure, you cause a drop in pressure. So it was actually, this is why there were so many jokes about this in the 2000s. Ask your parents or maybe not your grandparents, because they might, especially some of them might be taking it. But it was actually developed as an antihypertensive. That's why so many politicians are like, why are scientists looking up at ways to give like men erections? And it's like, no, it wasn't developed for that purpose. They actually developed it to deal with high blood pressure. By maintaining vasodilation, they thought maybe you would lower blood pressure. Now the interesting thing is that during the trials, they found out that some of the men were coming back because they liked that unintended side effect. And that's why they were like, hey, they actually like this stuff, they want more, let's market it. So this is the story behind how Viagra was developed. So it wasn't developed in terms of recreational